In a world of endless app scrolling, a growing number of young people are turning to social media to get medical advice, but doctors say listening to online influencers can come at a dangerous cost.
Our Shane Wright spoke to a local doctor and college student about the trend and what both sides need to do to avoid any health scares.
I think that's like all the time. I feel like if you're not walking with your phone, it makes it more awkward if you're not doing it.
Jasmine Frazier is a junior at FAU in Boca, and she's on her phone
Every day, all the time.
like so many college-age students who some stats show can spend up to 10 hours per day scrolling on their cell phones.
So it's much better to eat more protein and less carbs.
Influencers and just everyday people producing content.
Hey guys, I'm gonna make a cancer fighting tea with these soursop leaves.
Many of that content involving health tips about diet, nutrition, and even about how to treat their own conditions and diseases. A KFF study shows 55% of adults say they use social media to find health information. Jasmine admits she's one of them.
I know a lot of students, especially, a lot of us don't have health care or it expired. So I think it's just easier to just go look online.
Many times patients will say, well, I was scrolling online, I happened to find this interesting article that I found on Reddit, or I saw this influencer on YouTube, and I had some questions about this.
Dr. Carlos Victorica, a family medicine physician at Baptist Health, says a lot has changed since he started practicing medicine almost 2 decades ago.
What's interesting in medicine, there's been a dramatic change, in part because of social media, but also with the internet as well. There's an ability to disseminate information far faster than even we in medicine can keep up with, which is what results in our patients usually giving us many interesting questions at each office visit.
He says the information online often isn't properly verified.
There's always a risk of taking advice that you see online because you don't really know what the source is, you don't really know where the information is coming from, and at the end of the day, that influencer or that advice or that source doesn't necessarily have your best interest at heart.
It's a slippery slope. Those social media health tips don't take into account things like your own body type and your own medical history. So listening to the wrong information can do damage.
But if we have patients who have chronic medical conditions such as diabetes that's uncontrolled, or asthmatics, or patients who have coronary disease, and they choose not to take the advice of their physicians, the results can be catastrophic. So they can be very, very sudden.
Dr. Victorica says the speed and convenience of finding information about your health online can't be ignored. But it's up to local physicians to bridge that gap.
Where we need to do a bit better with this. We have to keep that line of communication open to patients. We have to keep that accessibility open. And I think that's why it's so critical that you have your provider who's making these decisions for you, because they know you well.
I think it's scary, like people can convince you to do anything.
Meanwhile, Jasmine says it can be hard not to get influenced by the influencers.
Once you start seeing it so often, it's like, maybe I should actually get into this. Maybe I should check it out. I think we're on a scary route. I think it should be regulated.
Shane Wright, WPBF 25 News.
And Dr. Victorica adds, if you are curious about a health trend or advice you may find online and don't want to wait until your next doctor's visit, try sending a message or an email to your health team for quicker answers.